Good morning, Lake Providence Church family. This is Dr. Linda Plummer Ward bringing you greetings from the Lake Providence Church Health Ministry. Let me start by saying thank you for those of you who recognize the seriousness of this pandemic and join us in doing all we can to slow the spread of COVID-19. Because you choose to wash your hands, cover your cough and sneeze, stay at home if you're sick, avoid crowds, wear masks, and practice social distancing, Nashville experienced improvement in some of our metrics this past week. So, congratulations! While we still have a long way to go, that improvement is encouraging. We are nowhere close to winning this fight with COVID-19. We need to continue these efforts to lower our transmission and our positivity rates. Fall is around the corner, and we need to get a better handle on COVID-19 before flu season begins. This will help prevent overwhelming the healthcare system during the fall and winter months. At this time, we remain in the modified phase 2 of the Nashville reopening plan. In particular, bars remain closed, gatherings are restricted to a maximum of 25 people, restaurants close at 10 p.m., and mandated face coverings are to be enforced by the Metro Police Department. Remember, people do not have to be sick to be COVID-19 positive. They may be asymptomatic carriers who would be positive if tested, but who have the ability to spread the disease anyway. When you're away from home, avoid people who do not wear a mask. If you go to a restaurant or other place of business that does not require a mask, you should leave for your safety. If you are able to do things outside, this is actually a safer option than being indoors with other people. Mask and social distancing are still recommended while outside unless no one else is around you. Exposure to the sun and simply being active are good for our physical and mental well-being. Learn how far 6 feet actually is away from you. For most of us, it is about 2 arms length and then some. Teach your children to recognize 6 feet. Remember that 6 feet is just a guideline from initial studies. Studies since then have shown that respiratory droplets may travel much farther and that smaller particles may be aerosolized and travel even farther than that. Masks should cover our nose and our mouth. A shield with no mask provides no protection except for the wearer's eyes. Temperatures are taken to identify those who may not realize that they are sick or have a fever. However, COVID-19 can infect some people without causing fever. Stay away from people who are coughing or who do not feel well. Stay home if you don't feel well. Make sure your children know this also so they can protect themselves and their families. If you have a small gathering, or if you must have a small gathering of people in your home, have wipes available, especially in the bathroom, so that they can clean after each use. The sink handles, the toilet handle, the seat, etc. Wipes and hand sanitizer should be readily available everywhere in your home in those situations. Food is best served packaged or plated to avoid too many hands touching serving utensils and food. If you must have people over, outdoor activities with mask and social distancing are safer than indoor activities. We thank you for your attention, and as always, be safe, be healthy, and stay prayed up.